Today is the first day of Black Maternal Health Week. The week raises awareness about disparities in maternal health outcomes among Black women. According to the CDC, Black women are 3 times more likely to die from a pregnancy-related cause than white women. But Mount Sinai is taking a holistic approach to closing that gap. And joining us now to talk about how is Dr. Sonya Brar, a Mount Sinai OBGYN, and her patient and new mom, Isedua Oribhabor. Good to talk to you both. Welcome.
Thank you.
Well, can you talk about why you wanted a holistic care team and how that support system helped?
Yeah, thank you. I think as a first-time mom, I definitely went into pregnancy with a lot of concerns and worries about what this would mean for me. And beyond being just a physical health journey, I realize it's also an emotional and mental health journey. So having a holistic team that included Dr. Sonya as my OB, a midwife and a doula, my doula, Janae Jackson, really helped me prepare myself both, physically and emotionally for the things that I would encounter in childbirth. And I think, especially as a Black woman and as a woman who has family members who've had difficult and rather traumatic pregnancies, having a team behind me was really key to helping me go through the pregnancy journey.
And Doctor, why are seeing disparities in maternal health outcomes among Black women compared to other races?
Yeah, so like you mentioned, statistically, we are seeing that Black women are at 2 to 3 times higher risk for pregnancy and postpartum complications than white women. And this is across the board, including both low and high income families. Possible reasons to explain this disparity can include systemic barriers for access to comprehensive health care, and unfortunate mistrust in the medical community, and higher rates of pre-pregnancy health conditions such as hypertension, diabetes, fibroids that can increase risk for complications like preeclampsia, higher C-section rates, postpartum hemorrhage, stillbirth, and even maternal death. So it's so important to raise awareness to this issue so we can start talking about it and acting on it.
Well, what advice can you share for Black women on how to advocate for themselves with their gynecologist?
Yeah, I think first it's key to find a provider that you trust. You'll be spending a lot of time with this doctor in very intimate settings, so finding a provider that you trust is really key, as well as having the freedom to ask questions and to ask questions again and again if need be. There's a lot that's we just don't know about pregnancy until you're in that position. So feeling free to ask questions as issues come up is important. And I would also say that it's quite key to have a team of women around you, people that you trust who've been through this before, they can compare experiences with and bring that knowledge into your meetings with your doctor. Yeah, and finally, just to understand that you know your body in ways that other people don't. So feeling comfortable and confident about raising issues that you feel are specific to you in those meetings with your doctor.
And Doctor, how is Mount Sinai's Department of Obstetrics, Gynecology, and Reproductive Science advancing labor and delivery care?
Yeah, we are always advancing labor and delivery care. We have a multidisciplinary approach to treating patients in labor. We have ongoing projects for lowering C-section rates. We offer wireless fetal monitoring to allow laboring patients the freedom to move during their labor. We have options to start labor inductions as an outpatient with Foley balloons to reduce hospitalization time. We have nitrous gas as an option for pain medication alternative for those who wish to avoid an epidural. And we also have rotational thromboelastography, also known as ROTEM, which is advanced technology that can diagnose bleeding disorders in 10 minutes. So we can promptly and quickly treat these patients, which can be life-saving. So we're always, growing and expanding to keep up with the times.
How is the baby doing?
She is happy and healthy and ruling our home with a tiny iron fist.
She is beautiful. Congratulations to you, and she's just the cutest. Great to see the both of you. Glad all is going well, and congrats on everything that you're doing, Doctor, too.